The mountains of eastern Kentucky are known for their beauty. They're also nationally recognized for a network of community healthcare centers. Today, MCHC continues to grow, expanding its service area and range of services.
The basic premise of Mountain Comp has always been, regardless of who you are, what color you are, how much you weigh, your ability to pay, that if you walk through those doors, you're going to get the same care as the person that was before you and behind you. And I think when you hold true to your values, which is what we've always done, that, in the course of 30 years, you simply grow.
Everybody's supposed to be greeted with a smile, treated the same. If they're one of the lawyers in town or the town drunk, it doesn't make a bit of difference to me. Everybody's treated with the same respect here.
If we had more systems of health care like the Mountain Comprehensive Health, we wouldn't have a problem with health care in Kentucky or access to health care in Kentucky.
If you plant a tree, you need to water the tree. The tree has to have some sunshine. You can protect it from a thunderstorm. That is what actually Mountain Comp is doing for physicians. It is providing a nurturing environment.
You can ask our patients, and they may not be able to describe it in words, but they know what Mountain Comp is. When you say Mountain Comp, they know that it's a place that they can come to where they can trust the physician taking care of them. They can trust the staff. I would never think about going anywhere else for health care myself.
Mountain Comp has grown from a very small practice to probably one of the largest primary care centers in the state. It's grown from a program that was a poor person's health program to a health program of choice by the people of the communities that it serves.
We did it in little baby steps. I mean, it was not like we had this great master plan. There was no way at that time that I could have imagined, or anyone else that was working at that time could imagine Mountain Comp as it is today. In January 1972, they gave us a couple of used trailers. That was in Leslie County, in Wooten in Leslie County. And we took those two trailers and put them together and put a roof over them and fixed a waiting room between them, and that was actually the birth of Mountain Comp's clinics. I had a couple doctors at McRoberts, and that was going well. And we had Leatherwood open with a couple doctors and a couple dentists, and that was going well. And we had no plans on coming to Whitesburg. But then in 1975, they came to us and offered us, that they would help provide a space and all like that if we'd put a clinic in Whitesburg. And of course, we started out in an old hotel building. I mean, hotel rooms became exam rooms, and we were there 20 years in the old building, from 1976 to 1996. We were seeing 300 patients a day out of that old building, and we didn't have a single parking spot. So finally, it dawned on us that if we were going to keep on growing, that we probably needed to have a better building with proper plumbing and wiring and at least a parking lot. We started planning on this new clinic. We moved in December of '96. And, we just added a doctor at a time. I honestly think that, as I look back now, that I had a dream. I mean, it was not a very realistic dream. But actually, I think what I did was sell my dream to a lot of these doctors.
They've been very supportive, and they had to help me through this immigration purpose, and also initially when I had to build up the practice. We have very supportive colleagues, which really helps the situation. And if you needed any extra equipment and all, the company always helped.
In order to stay in this country, they can only go to a place that is certified, which we are certified because of need. So all of this area, because of the lack of doctors, was deemed underserved. And they liked what they saw and what we were trying to do, and they stayed. The thing that has probably made Mountain Comp succeed as much as anything is that we use all local labor. The doctors come and go, but Mountain Comp stays the same.
All right, everything looks great. We'll see you back in a week. Now you're down to the 1 week.
People know that if we deliver them, this year, if they want to come back 2 years from now, that the chances are great that we're going to be there. So, I mean, they like familiar faces.
I know entire families. Their whole families come here. I know their mom, dad, brother, sister, son, daughter, niece. Treat their whole family. Know everybody.
Primary care is the entry point into the healthcare system. It's where you go for your basic health care. You got a cold, you've got an earache. It's usually a person's first contact with the healthcare system. The concept behind a corporation like Mountain Comprehensive Health is community-oriented primary care, where the ownership is vested with the people who receive the care from the organization.
My grandfathers on both sides of my family were coal miners. My great-grandfathers were coal miners, and my father was a coal miner. I take a lot of pride in seeing coal miners here. When they come in here and they start describing an injury that they had, they kind of look at me twice when I say, well, really, I can understand how that happened, or I describe the piece of equipment that they were running. And I have an extensive education about the coal industry and the daily hardships that coal miners go through.
The answer was not doctors coming and staying 2 or 3 years and leaving. That the answer to medicine in the mountains had to be our own.
Well, MCHC had everything to do with me becoming a doctor. My mother obviously has run this company for 30-some years, and so as a child, the only thing I was ever exposed to was healthcare clinics and people of Eastern Kentucky. So it was a very natural thing, and it seemed to me the only pertinent thing to do was to go to medical school.
We started working with local kids even when they were in high school. We used to let them work in summers and Christmas vacations, and we'd put white coats on them, and the staff would all call them doctors. And they thought that was just great. And we've been very lucky. I mean, a lot of them have come back.
I think I made the right decision coming back here. I have never thought twice about doing that. I was always focused on coming here and stayed motivated to come here, and never had any second thoughts about going anywhere else.
Rural areas are made for family physicians. I think that's where family physicians seem to thrive and do better. But there are times when you need the input of your specialists, and it's nice to have those close to home.
It is what it says it is. It's a comprehensive system. So it deals not only with primary care, but also with some specialty care as well as preventive care. And that's what's really needed in the community.
What we saw is that it was hard for our patients to get to specialty care and to specialty equipment. So what we envisioned about 5 years ago was that not just provide primary care, but provide them with the essentials of care. Our biggest referrals out were cardiology for different x-ray specialties and for pulmonary medicine because of black lung disease. Our goal was to try to bring a cardiologist in, to bring a pulmonologist in, and get some specialized equipment to prevent our patients from having to drive 3 hours to Lexington.
We do have a significant amount of tests that we can do here.
Yeah, you did very well.
I provide many specialized services which are actually provided in tertiary hospitals, like putting pacemakers, like putting intracardiac defibrillators, which are devices which help patients prevent from dying from sudden cardiac death.
When you think of Mountain Comprehensive Health, I think of it also as a system of health care that's expanding. And instead of just providing care to the patients right there in Whitesburg or the immediate community, it's beginning to expand so that there is better access to health care for that whole region.
Every single thing that's happened has happened a brick at a time. About 2 years ago, when we realized that we were just running out of space again, That's when we decided to tie the two buildings together, and that's what you see now.
There's a need, and that need, you know, they're meeting the need in Whitesburg. They're meeting the need in Boonville. They're meeting the need in Buckhorn. When you have a vision and the substance to go with that vision, and it's something that other communities need and want and are willing to join, it seems to me it's a logical marriage, successful marriage.
This clinic is hands down the best equipped, best staffed regional rural health clinic that I have ever been exposed to. And I know that sounds biased, but I'm telling you, I've been in a lot of clinics in a lot of different places in a lot of different areas of this country. This one, hands down, is the best for my situation, in my opinion.
I can tell you that if you want to stay and if you are content and if you want to be happy, then Mountain Com is a very good place to practice medicine.
Thank you very much.
Thank you.
Take care.
Everyone how fabulous you are.
Oh, thank you. You need more business, we think. Okay.